Uh, Hi, everyone, and thank you so much to Dr. Fernandez for hosting us here in Texas. So I'm Mandy O'Connor. I'm from Monash University in Melbourne, Australia, and I wanted to talk to you today about development and implementation of an outcomes framework in early parenting centres. As an acknowledgement, I'd very much like to acknowledge the Early Parenting Centre network that we've worked with and my team at the Health and Social Care Unit, particularly Dr. Angela Melder and Professor Helen Skitteris. I'd also like to acknowledge the Indigenous First Peoples on the lands on which we work, live and play, and pay my respects to all of those who have been involved in this project with us. So Victorian Early Parenting Centres are public hospitals within Victoria. They are a free primary health service that provides support for Victorian families with children who are aged up to 4 years of age. They use a wellness model to support families, and families will come on site and participate in programs that range from residential stay programs of 5 days through to day stay programs and in-house, in their own home programs. And they have a very multidisciplinary workforce to support that care. About 4 years ago, the Victorian State Government provided extensive funding and support for the expansion of this network, and that has grown from 3 existing early parenting centres to 13 early parenting centres. So a huge increase in the volume of families that can now receive support in Victoria. As part of that, we were commissioned to develop an outcomes framework. So up until then, we hadn't been able to measure the impact of the work that was going on in these early parenting centres. So this was developed through an extensive research and key stakeholder consultation process. We had well over 100 key stakeholders across the state involved in the development of this framework, and it measures the system impact of the work that goes on within these centres. It enables the organisations to align their programs, to assess their service delivery trainings, have a look at their policies, their quality improvement, and to be able to work towards achieving the outcomes that they stipulated and developed for this framework. Because there was such a heavy involvement with everyone and quite passionately involved in developing this framework, we didn't want this framework to sit on a shelf, which lots of them tend to do. So as part of this framework, we included an implementation plan, how novel, and we included a lot of the feedback that we had been receiving through the development process of the outcomes framework into the development of this implementation plan. And we also included extra consultation process with the largest early parenting centre that we work quite closely with. So I'll go into that just in a minute. So this is the outcomes framework. As a snapshot for you, we used a socio-ecological model in the development of the framework because we understand that it takes a village to raise and support children. So we have outcomes across child levels, family levels, the community, the workforce, the organisations themselves, as well as government. And we were able to determine that we're 3 overarching outcome areas that you can see there. To break this down further, those outcome areas include, outcome domains include specific outcome areas that provide more nuanced and detailed information that we were looking at, that we want to be looking at, and to be able to track progress and measure what's happening within these areas. The report also contains key result indicators that we've linked with specific measures to be able to track what's going on within these outcome areas. And then we have our implementation plan that sits behind all of the outcomes framework so that we can really embed this outcomes framework into practice. So developing the implementation plan, we spent considerable time with our key stakeholders again and explored these implementation determinants with them, discussing their barriers and the facilitators and what they would think these look like on the ground as they were implementing this outcomes framework. What came together was 3 key implementation strategies. Overarchingly, the first one looks at planning, the next one looks at education, and the third one looks at data and monitoring. And these can be operationalised at any point. It's not a linear process, it's what works for each of the early parenting centres at the time. This is just a snapshot of what's contained within the implementation plan and how we broke that down. So this is the overarching planning strategy. We're able to break it down into implementation approaches, suggested activities, and we also allocated implementation owners so that there were people or groups of people who were responsible for these activities to embed the outcomes framework into all of their work. And these were just the education strategy and the data and monitoring strategy. So this is our framework, our outcomes framework, and including the implementation plan. We asked staff to have a look at what were those socio-ecological levels that are related to their roles and teams. We asked them to identify those outcomes that they may be responsible for. And then we had them consider those strategies and activities approaches that are included in the implementation plan. They then came together and brought together their own local implementation teams within each of their centres, and we had them build their own local implementation plans so that they could really tailor what we were suggesting within this broad implementation plan in the framework to make sure that it was context specific for them and for their families and communities. So they were focused for the planning strategies, focused on disseminating and engaging that framework across the organisation. For the education strategies, they were involved in taking that integration further and embedding the framework into practice. And they did this by developing their own education strategies for their centres, and an overarching clinical practice guidance was developed collaboratively by all of the centres and is now utilised across the whole network in Victoria within the early parenting centres. And that was a really key activity that everyone was engaged in, and we now are seeing this outcomes framework embedded in everyday practice across the whole organisation. We're still working through all the data monitoring and strategy, looking at the existing tools and measures, bringing in how we can be bringing the data collection processes together, the analysis and the reporting. What does this mean for us as implementation scientists, and what have we learned? So those key constructs that are leading to this conducive scale-up process that we've been working on, and we've been doing that for the last couple of years. Sorry, I should have said that at the start. So cross-sector co-creation and extensive consultation was really key, and significant development of those productive ongoing relationships was critical. So relationships overarchingly was the most important thing moving forward, and building that trust between the early parenting centres and us as implementation facilitators, and helping them to build their own local implementation teams. Facilitating their implementation plans really required that skilled embedded implementation practitioners, and they used the blueprint that of the implementation plan to develop their own. The context is was that staged approach to implementing it across the site. So we had 3 existing sites who were already up and running and had been doing so for over 100 years. They were ready to run with this outcomes framework and the implementation plan. We started with them, and as the new services have been coming on board, we've been working closely with them alongside our existing early parenting centres and their local teams. So that's very much contributed to working towards that long-term vision of system change and supporting those new services as they come on board, promoting that sustainability moving forward. I think that is all. So thank you for listening, everyone.